Hello, good afternoon. And now we will be discussing uh, the topic about baby bath. Okay, so baby bath is very important as for you as caregiver, especially this is a skill that you need. This is a skill that you need to perform during TESDA certification. So you need to be expert on doing baby bath. So we have different types of baby bath. Sorry, let's start with the definition. So, baby bath is defined as cleaning of the skin of the baby for promoting hygiene and comfort in the home setting. So, our objectives in doing baby bath is first to keep the baby's skin clean, to refresh the baby. We can stimulate also the blood circulation in doing such thing, prevent any skin infection, closely observe the body for evidence of any abnormalities, and to note infant's growth and development. So, anong abnormalities ang pwede nating manotice? We can notice some skin irritation, skin problems. So, during baby bath, we can notice that. Then, to induce sleep. So, sino mang naligo, of course, it can help to induce sleep because they are refreshed. Next, we have different types of baby bath. We have the lap bath, we have the sponge bath, we have the tub bath, we have also oil bath. So, lap bath is bathing the baby keeping on the lap. Okay? Sa lap nyo, papaliguan ng baby. Here, the mother sit on a stool and can sponge and change his dress on her lap itself. Then, sponge bath, bathing the child in the bed. Usually, it is being done to those patient like patient na partial bath lang na hindi pwedeng paliguan sa tub bath. And tub bath, this is common method of giving bath, and this is the one we are be doing in our demonstration also in demonstration in the test the certification. We can also use oil bath. Oil bath is usually done to those patients na premature. Okay? So, because mas premature ang baby, hindi nila kayang i-resist yung cold, pwede silang magkaroon o mag-develop ng hypothermia. So, oil bath ang binibigay sa kanila. So, we have different instructions for giving bath. We should always remember that if we're giving bath, okay, we use always warm the room and warm the water. We should close the uh, windows, the doors, okay? So our patient or our baby will not have the risk of hypothermia. Bath quickly and gently. Okay, bath quickly and gently. Mabilis lang kasi pwede nga siyang mag-hypothermia. Dry quickly and gently. Any part ng bata na pinapaliguan natin, for example, inunan natin yung ulo. After nating pinaliguan, dapat i-dry natin siya quickly, agad-agad. Hindi hintayin nating i-dry pa siya after nating matapos yung buong katawan. So, dry nyo agad once na bawat part na pinaliguan nyo. Then, never leave the baby unattended. So, may risk na gumulong si baby at may risk sa fall. The infant is given bath after the cord falls and umbilicus is well healed. So, usually, pinapaliguan si baby after 7 to 10 day. Okay na yon, tuyo na yung kanyang pusod. So, what are those general instructions for giving baby bath? So, ideal time for bathing as a baby is before the second feeding. Okay, bakit second feeding? So, after ng first feeding niya, maghintay ka ng after 2 hours. After 2 hours, at least busog siya, hindi siya iiyak uh, habang pinapaliguan mo. And after first feeding, before second feeding nga, para hindi siya magsuka. Kasi pag pinaliguan mo, nakakadede lang ng bata, pwede siyang maglungad or magsuka. So, taking care that the baby is not tired or hungry. Baby should not be bathed within an hour he is fed, as I've told you, kasi pwede siyang magsuka. There should be a fixed time for bath, usually every morning. So, dapat fixed yan. So the newborn's temperature regulating system is underdeveloped. So measure the temperature of water. So it should be 37 to 38 degrees Celsius or 98 to 100 Fahrenheit. The clothing should be selected. So kung tag-init, dapat pang mainit din yung weather. Kung taglamig, pang taglamig din yung damit. So the soap use should be mild. Hindi tayo pwedeng gumamit ng kung anong ginagamit natin ng adult, ipapagamit nyo sa kanila. Kasi mabilis ma-irritate ang baby skin. And avoid using talcum powders because it contains zinc stearate which irritates the respiratory tract. Ano yung talcum powder? Actually, we are so fond of using and we are so used of using pulbos. But according to the study, uh, it's not acceptable na maglagay tayo ng pulbo sa bata. Bakit? Kasi pag na-inhale nila yun, pwede yung mag-cause ng respiratory tract irritation. Kaya minsan hinahatching yung bata, minsan hinihika because of that. Close windows to keep off drought and to provide privacy. Collect all articles, okay, para hindi ka na may nakalimutan ka, then iwanan mo yung baby, tas pwedeng mahulog yung baby. So, dapat complete lahat ng mga gagamitin mo. Then, keep the table against the wall. Place the tub or basin on one end of the table and the tray with articles on the other end conveniently. So that the baby will be protected on three sides and there is less chance of the baby's rolling off the table. So, dapat yung pagpapaliguan ni baby na table, dapat against the wall. So, walang possibility na mahulog siya. Then, place the towel, wash hands, and wear apron para hindi ka mabasa. See whether the baby is wet with urine or motion. So, dapat tanggalin mo muna yon, linisin mo muna bago mo siya paliguan. If so, clean the part. So, anong mga contraindications? Yung mga hindi natin pwedeng paliguan ng bata. First is hypothermia. Hypothermia is decreased temperature. Convulsions is yung nanginginig yung bata. Bronchopneumonia is infection to the lungs. Cyanotic heart disease, yun yung mga naging kulay blue yung bata. So, may problem yun sa lungs. So, hindi siya basta-basta pwedeng paliguan. Then, fresh burns, critical illness, and premature infants. As I've told you, ano ginagawa sa premature infants, usually they are using oil bath. So, ito yung mga gamit na gagamitin natin, which is hot water, tepid water, buckets, mug, mild soap, hair oil, swab sticks, and cotton balls. K-basin, thermometer. Thermometer is used to check yung temperature ng water natin. Clean clothes, betadine, normal saline, low stool, and apron. Okay, so later on, I'll show you how baby bath is being done in a video. Okay, so now we'll proceed to diapering. Okay, diapering also is one skill in TESDA certification. So these are the guidelines while doing the diapering. First is always wash, and first and foremost is you wash your hands before and after each change. Put your baby on flat, safe surface such as change table with side rails or on floor. Keep one hand of the baby at all times. Never leave the baby unattended. Then babies move around, so keep creams, pins out of reach. Then wipe the diaper area with a warm, wet washcloth or non-perfume diaper wipes. Usually, ideally, we need to use a warm water with a washcloth or warm water with a cotton. Okay? The the wipes that we are using, it will irritate the skin of the baby. So make sure it is non-perfume. But ideally, it should be warm water with soap, warm water with washcloth or cotton. And the dry, pat dry the area and air dry. Do not use powder or corn starch because it will cause respiratory irritation, as I've told you before. So, guidelines, always keep from front to back. Always wipe from front to back. Katulad ng sinabi ko dati sa hygiene perineal area, lagi tayo mag-start from front to back. So, from female, kung male siya, from clitoris, uh, from genitalia down to the anus. We don't need to wipe the clitoris to check where is the clitoris of the baby. No need. Just wipe from the genital area down. Okay, no need to do the same procedure in adult. Then gently clean between the other folds of the labia. There's no need to clean inside the vagina. Do not pull the foreskin back when cleaning the penis. Okay? Before securing the diaper, ensure baby's penis is pointing down to avoid being streaming up. So, dapat nakababa siya. So, procedure later on, I'll show you. So, dressing and undressing, handle your baby carefully and gently. Remove clothes with care. Choose the correct size of the clothes. Make sure your baby's clothes are safe. Dapat safe. Then, choose layers when dressing your little one and place baby on a safe, flat surface. Procedure. Another topic is cleaning and sterilizing baby's bottles. We have different ways of cleaning and sterilizing baby's bottles. But in cleaning bottles, we should follow this. Okay, so this is the reviewer I did for the students who had the test certification before. So first step is when we're cleaning items by hands, first step is you wash your hands, of course. Then, you take it apart. So pag hiwalay-hiwalayin nyo yung baby's bottle, then wash the items with the water. So place it in a clean basin, not in the sink. We all know that the sink is very dirty, so we should place it in a clean basin. Okay, dedicated only for the baby's items. Okay, don't put in a basin na ginagamit nyo sa plato. Okay, maglaan kayo ng basin na para lang sa baby. We all know that baby have a underdeveloped immune system. So microorganisms can infect them easily. So fill basin with hot water and soap, then scrub it using uh the what's that? The scrub for the baby's bottle, and then squeeze water from the nipple holes. After washing it, putting soap and everything, then rinse it again. Then make sure that you air dry it para hindi siya bumaho at hindi siya mag-moist. Kasi moisture can attract microorganisms. Then, clean mo ngayon yung basin and then yung bottle brush. So, these are the steps in cleaning items by hands. Okay? Sterilizing or sanitizing infant bottles, we have three ways. Okay? We have three ways. First is boiling. Okay? Boiling or pagpapakulo, we should boil it for 15 to 30 minutes. Bakit hindi less than 15 minutes? Kasi according to study, 15 to 30 minutes is enough, okay, to kill almost almost the microorganisms which is present in the bottles. Bakit hindi more than 30 minutes? It's because pwedeng masira yung bottles pag masyadong matagal. Okay? Make sure that when you're doing boiling or removing the items in the boiling water, make sure to use with tongs. Okay? Huwag niyong kamayin. Then, another uh, another way is steaming. Steaming is yun yung ilalagay nyo yung bote, okay, may water, tapos ilalagay nyo yung bote sa taas. So, para kayong nag-steam ng parang pag nagluluto kayo ng uh, puto. Okay, so nilalagay nyo yung puto sa taas ng water na nag-i-steam. So, pwede rin natin siyang gamitin para mag-sanitize ng bottles. And it's very effective. So, place disassembled items in a microwave or a plug-in steam system. So, steam system, yun yung pwede kayo magpakulo ng water. Then, sa taas nun, yung parang may steamer, ilalagay mo dun yung bote. Next is bleaching. Okay? Bleaching, we have different bleaching solutions na pwede natin gamitin para sa paglilinis ng baby's bottles. Okay? Usually, the solution is 1 teaspoon of unscented bleach. Okay? Meron nabibili yan sa market. Plus gallon, 16 cups of water, 16 cups of water in a clean wash basin. So, soak mo lang siya doon ng 2 minutes and then hugasan. Submerge items completely, no bubbles in the bottle. Squeeze the nipple hose and then soak for 2 minutes. Okay? So, that are the 3 steps for sanitizing infant bottle: boiling, steaming, steaming and bleaching. Okay? Next is steps in bottle feeding. So, pag nagpapadedi ka na using bottle and formula feeding, ano yung mga steps na gagawin mo? First is make sure all bottles, nipples, and utensils are clean. Yung mga gagamitin mo, make sure na dapat malinis. Then, what is terminal heating? Terminal heating: fill with prepared formula and cap them loosely. The filled bottles are placed in a pan with water reaching about halfway up to the bottles, and the water is brought to a gentle boil for about 25 minutes. So, ano yung terminal heating? Ginagawa mo to just to boil a bottle. Okay? So, maglagay ka ng prepared formula. Okay? Yung naka-prepare na ng formula, ilagay mo siya sa pan. Okay? Then, uh, halfway ng bottle. Okay? Kalahati ng bote, yung water. Then, i-boil mo siya for 25 minutes. In that way, you can heat the baby's formula. Okay? Next is warm the refrigerated formula. Okay? That's terminal heating. Then, prepare the formula. Then, warm the refrigerated. If refrigerated, warm it. You can use the terminal heating. Then, place in feeding solution. So, place in feeding position. So, ano yung feeding position natin? Make sure na mas mataas ang ulo kaysa sa katawan. So, your patient will not choke. Then, take note of baby's intake. Okay? Make sure, tingnan nyo, baka yung bata kasi, dyan natin makikita kung may problema ang bata. Pag less lang siya dumede, baka may nararamdaman siya or meron problema sa bata. So, isang way yan to know kung meron siyang illness. So, paano ka magpe-prepare ng formula? Water before milk. So, ano ang una mong ilalagay? Tubig or milk? Dapat ang una mong ilagay ay ang water. So, example ratio, ito tinatanong to sa testa. Example ratio is 2:1. Okay? It depends. It depends. If your the assessor asks you what is the dilution of the formula, okay, it depends upon the instructions. Kung ano yung nakalagay dun uh, sa instruction dun sa uh, formula. Nakalagay dun sa may preparations instructions. So, nakalagay doon kung ano yung ratio ng tubig at saka ng milk. So, meron tayong example ratio dito. Pag nag-ask siya, anong example ratio na pwede mong ibigay? 2:1. So, pwedeng 2 scoops of milk and 1 ounces of water. Laging sa water, ounces. Sa milk, scoops. So, ito yung pwede natin. Bakit mas mataas ang milk kesa sa water? Okay? Pwedeng magkabaliktad yan. Pwedeng maging 2 ounces of water and then 1 scoop of milk. Kung ang bata ay nagtatae, mas marami ang water. So, either different way. So, we will all know we have, if it's too much water, okay, it will lead to malnutrition. Bakit? Kasi walang gatas masyado. If we have too much formula, it will lead to diarrhea and dehydration. Okay? Next is burping. Okay? After pasusuhin ng bata, dapat i-burp siya. Okay? Bakit natin ipa-burp? Para ma-prevent ang vomiting and spitting or paglulungad. So, we have three ways of burping. We have the over the shoulder, like in the picture. We have the lying down, and we have on the lap. lap. So, you should always have this uh, towel para pag naglungad si baby is meron tayong pang punas. So, ayan yung mga different ways of burping the baby. What are the things we need to know about formula preparation? Is there a special bottle or teat I should use? Plain shaped bottles are easier to clean. Meron tayong mga teats kasi na iba-iba yung mga design. So, mas better yung plain shape na bottle teats lang. So, it will be easier na linisin. Then, big teats holes, risk siya sa choking. Pag small teats naman, yung holes, yung mga butas, maliit lang, malnutrition, and it's very tiring for the baby na magsuck. Then, what do I need to make up for, formula? So, you need bottles, teats, knife, not a sharp one, used to level off the formula. Then, plastic or metal, a bottle brush, and equipment for sterilizing. What kind of water to use? We can use tap water. It is rich with fluoride. Fluoride is very helpful in the development of the teeth. Okay? So, pag gumagamit ka ng tap water, you should boil it until 6 months ng baby. Pag gumagamit ka naman ng tap water with filter, needs to boil it also until 6 months. Then, let water cool before use, lukewarm or room temperature. Spring or bottled water should only be used if you can't use tap water. If you're using spring or bottled water, you should boil it until 12 months. Then rainwater can be used but need to boil until 5 years of age. Sa mga places na hindi na reach ng nawasa, ng mga uh, water supply facilities, okay, ang kinukuhanan lang nila na water supply is rainwater. So, it can be used unless they are not using the rainwater which is pouring on the roof of the house. Di pwedeng gamitin yung tumutulo galing sa roof ng mga bahay. Dapat directly from the rainwater. Then, never use mineral water. High salts, never use mineral water dahil mataas yun sa salt contents and minerals na pwedeng detrimental sa health ng baby. Do's and don'ts of making up formula feeds. Manufacturer's instructions vary as too much water and powder use. Ano ko na to? So these are the steps in preparing a formula feeding. As I've discussed in the previous discussion. So this is all about baby bath, sterilizing and cleaning infant bottles, and dressing and dressing baby and diaper change. So ito yung diniscuss ko because it's very important because this is being asked in TESDA certification. So thank you. for listening.